all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Good morning, everybody, and welcome to Carn Health Hour. My name's Dr. Kemi, and I'm a GP trainee in Northwest, and it's amazing to have everybody here with us today. I want to welcome everybody on all your different platforms, whether that's YouTube, Zoom, LinkedIn. And it'd be great for you to comment where you are and just to comment throughout the session so we get some engagement. So there's going to be someone who's looking at the comments throughout the whole program so they'll be able to see what you're saying. So I'm just going to start by introducing the guest speaker today. So the topic is on healthy eyes and spotting early signs. And it's great honour to introduce Miss Evelyn Mensah, who's a consultant ophthalmologist in London Northwest University Hospital. And she's also the president for the ophthalmology section of the Royal Society of Medicine. So it's great to have you here, and we're really looking forward to hearing how we can keep our eyes healthy and spotting early signs. So I want to welcome everybody and hand over to Miss Mensah to give us this talk.
Hi, good morning, everybody. Thank you so much for joining on this lovely Saturday morning. So as Dr. Kemi has just explained, I'm going to talk to you about eyes, topic that I'm incredibly passionate about. It's my daily job. Let me just see if I can just share my screen and put this into slideshow mode. So I'm going to talk to you today about healthy eyes and spotting early warning signs. My name is Evelyn Mensah. Everyone calls me Evie. My title is actually Miss rather than Doctor, even though I promise you I am a qualified doctor. It's just that I'm a surgeon. I am married, so it's very confusing with my title being Miss. But the overview for my talk today, I think it's always nice to start talks with a little bit of an icebreaker. So we're going to do an eye anatomy quiz. So you've got to get your quiz hats on. Then I'm going to go through some top tips about keeping your eyes healthy. And then I'm going to go through a few eye conditions. So I hope you find it interesting. So I kind of always start my talks like this. I always think it's really important to see, when you're talking about a particular topic, to understand what it is that we're actually talking about. So I think you may be able to unmute yourselves, but I just wonder if anybody can tell me what structure this is at the front of the eye. All of this is at the front of the eye. All of this is at the back of the eye. But what's the clear window, this clear structure at the front of the eye labeled 1? Does anybody know what that is? Can anybody unmute or put it in the chat and say what structure number 1 is in the eye?
Is it the sclera?
No. So you think it's the sclera, which is the white coat. You know, when you're looking at the white of your eye, The strong coat of your eye is called the sclera, this structure here. I hope you can see my arrows, by the way, which and overlying the sclera is the conjunctiva, all right, which is kind of like a loose, semi-translucent tissue. But your ability to see is based on the front window of your eye, which is literally like a plain glass window. And this structure here, number one, what's it called?
Is it called a cornea?
100%. I don't know who that was, but you got a gold star. Yeah, that's definitely the cornea. All right. Now, what is structure number two? It's a gap in the colored part of your eye in the middle. It's actually not really a structure, you know. It's actually there, but not there, if you understand what I mean. Does anybody know what number two is? A gap in the middle of something else, which I don't want to say what it is because you have to say what that is too. Does anyone know? It looks circular and it's in the middle of the colored part of your eye.
Is it the pupil?
That's
100%.
Irish.
I don't know. It's pupil. I don't know who said pupil, but that was the correct answer. Well done. Now, structure number three sits behind the colored part of the eye. And the best way that I would describe it is like it's like a glass pebble. A glass pebble. It's clear, it's transparent, and it just sits behind the colored part of the eye. And it works with the cornea as the light comes through the pupil to converge the light onto the back of the eye. Does anybody know what this structure is? And it's held in place with these little bits of string called suspensory ligaments onto the ciliary body. Do you know what it is? And it
That's
changes.
lens.
Sorry?
Lens.
The lens. Perfect. It changes shape to allow you to focus for the distance and for the near. So when you're reading things, what happens is the suspensory ligaments, they sort of contract and they make the lens get fatter and let you focus for near. And when you're looking in the distance, they kind of contract and they stretch the lens out and they let you focus for the distance. So that's your lens. And when your lens can't move very well for reading, this is an aging change. It's called presbyopia. So some people, you know, when they're reading things, they say, oh, I just take my glasses off to read. But as you get older, your lens's ability to change its shape, it becomes much more difficult. And so people need to put on a pair of reading glasses. And those people who I can tell don't want to put those reading glasses, their arms are getting longer and longer, so they're holding it further away so they can see. So well done. Now we're coming on to the actual colored part of the eye. For most people sitting in the Zoom, watching from Facebook, looking via LinkedIn and on YouTube, this colored part of our eye will not be blue, it will be brown. What is that? Number four. Colored part of your eye gives everybody different colored eyes.
The orange. Oh, I think it's orange or yellow.
No. Number four, it's going onto this colored part here. Colored part. It's got the gap in the middle. The pupil gets bigger and smaller because this structure, the muscles relax or contract. What's it called? What gives your eye the color that it has? Does anybody know? I'll give you a clue.
Is it epithelial cells? Or,
No.
keratin.
No. The front part of the eye, the colored part of your eye, right? This bit, it's on the side. It's sideways here, yeah?
The
It's got a
iris.
gap in the middle. Iris, yes, the iris. That gives you the color of your eyes. Fantastic. You guys are doing amazing. Okay, so now we're going to the back of the eye now. When the light comes into the eye, it focuses on one part of the eye, this one here. I don't want to say what it is because it's the wrong, that number's not next, yeah? And it sends signals from your eye to your brain. this structure here, leaving the back of the eye, is like a wire cable from your eye to your brain. Does anybody know what it's called?
Is it the retina?
No. This cable, this long thing here. The retina lines the whole of the inside of the eye. But this one here, the cable from the eye to the brain, it
Optical
actually
nerve.
allows you to see.
The optic nerve.
Yeah.
Optic nerve, fantastic. That is your optic nerve. And your optic nerve is really like a wire cable. I don't know, nobody's going to know the answer to this, but does anybody know how many nerve fibers there is in the optic nerve? Just give me a guess. Anybody? How many nerve fibers in the optic nerve?
10 million.
Reduce it by 10%. It's 10% of that. It's 1.2 million. So well, almost good. Well done, actually, whoever said that. Now, number 6 lines the whole of the inside of the eye. Someone said what that was. It's
The
like the
retina.
film retina. Exactly. If you remember, I don't know whether there's anybody here old enough to remember what an old 35mm camera was like. Your retina is like that 35mm film in the camera. The lens is like the front of the camera with that lens, all right? Now, there is one part of the retina that we use to see things in fine, clear detail. So when the light comes into the eye, it focuses at this point here, the center of this thing here. Does anybody know what it is called?
Is that
That's
fovea?
not the pigment, is it?
No, it's one part of the retina, right?
Oh.
It's about the size of a pinhead.
Is that fovea?
It is the fovea. Who said that? You get 1,000 gold stars. I don't know who said that. Because let me say,
I got almost all your questions.
you got that correct. That is the fovea. But you know what? This diagram is actually wrong. They said it's the macula. It's not. It's the center of the macula. The macula is bigger than that point there. The macula is bigger, and that is actually the fovea. So well done. All right. Okay. So anyway, you're all eye experts as far as I'm concerned, because you named all these different parts of the eyes. And you know, we are all different. Our eyes are all different. Everybody's iris has got different fibers and different positions. Everybody's eyes are different. There are no two eyes that are actually the same. And that's really important to recognize. So these are my top tips for healthy eyes. Okay. So my first top tip is to actually have regular sight tests. I know people struggle to say ophthalmologists, and sometimes when people look at me, they think I'm an optician. I am not an optician. I'm a qualified doctor who went on to do the speciality of ophthalmology. But regular sight tests are done by the optician or the optometrist. And this sight test is really important because it may help you detect underlying general health conditions such as diabetes, high cholesterol, and high blood pressure. These features of these conditions can be seen in your eye. The general consensus is everybody should have a sight test every 2 years or more often if your optometrist recommends it. Now, everybody talks about reading letters on the chart. The normal vision is not at the bottom, all the way at the bottom. It's this line here that says VCOZH, which is what people would say is either the 6/6 or 20/20. Americans say 20/20. In UK, people say 6/6/6. Nobody really understands those numbers. But what that's just trying to say is that this is normal vision. This is actually a logmar chart, so it's 0.0, so people won't understand that. When you're driving, you need one eye to be 3 lines above this, at least. All right? This line here, which is about 612, okay? Logmon 0.3. You can drive a car even if you've got poor vision in one eye, but the other eye the vision is about that level there, because there are lots of people who are going around with what's called a lazy eye, which is an eye that's not fully developed and it doesn't see right down to the bottom of the chart. Okay. You need to eat healthily to have good eyesight. All right. There are lots of vitamins that you can actually find in our fruit and veg. The most important vitamins are A, C, and E. So if you have at least 5 portions of fruit and veg a day, then you should keep your eyes in good health. Remember when we were talking about the macula in the anatomy quiz that we just did now? The macula has got a lot of what's called lutein within it. Lutein can be found in dark green leafy vegetables such as spinach and kale. I don't know whether you remember a couple of years ago when you went to the supermarket, there seemed to be kale everything, kale this, kale that, kale crisps. And that's because of the lutein, the high amounts of lutein that there is in kale that keeps your macula healthy. And this is really important if there is a family history of macular degeneration, which is a condition which can cause loss of your central vision. You'll have good peripheral vision, but your central vision will be gone. And I'll be talking about that condition later on. So if you keep your diet healthy and balanced, then that again will reduce the risk of any eye conditions. There is a myth that if you wear glasses, you're going to make your eyes weaker. That is a myth. If you've got prescribed glasses, that means that you need to wear them. People can wear glasses if they are short-sighted, i.e., if you're short-sighted, that means that you cannot see in the distance without your glasses. But when you put your glasses on, you can then see for the distance. That is a short-sighted person. Somebody who is long-sighted can see in the distance, usually without glasses, but they need to put their glasses on for reading. And there can sometimes be people who have got a condition called astigmatism, where the shape of the eye is not shaped like a football, so the light focuses into one point. It's shaped more like a rugby ball, and they will need glasses. So please, if you need your glasses, stop putting your eyes under strain. Stop squinting your eyes to read things, or put your arms far away, or squinting in the distance because you can't see. That, to me, is unnecessary stress. Unnecessary stress on your eyes. Put your glasses on. There are so many different types of frames that you can get, online, wherever. So just wear them and just, relieve that strain on your eyes. My other top tip is to take regular breaks. In this world of digital technology, everybody's on their phones, everybody's on their iPads, everybody's looking at a screen, devices, screens. There's lots of people. I'm using a device right now. You guys are using a device to see this talk that I'm actually giving to you right now. But it's really important to take regular breaks because sometimes people can get in that zone, either with their work, either with a game, or with a spreadsheet or something. So if you can remember the 20-20-20 rule, and what that 20-20-20 rule is, every 20 minutes, take a break. Find an object 20 feet away. 20 feet is probably about 6 meters or so. Stare at that object for about 20 seconds, and that will relax your eyes, all right? The other thing that happens when people are looking at devices is that they forget to blink. Remember the cornea, the window at the front of the eye, it's got no blood vessels in it. So it gets its nutrients from the oxygen in the air, which dissolves on the tear film at the front of the eye. You need your tears almost like they're almost like your lids are like windscreen wipers, but what they do is that they actually put a layer of tears on the surface of the eye. So you've got to remember to blink, or you can get dry eyes. And when your eyes feel dry, they will feel gritty. So this is why sometimes when people are looking at devices, looking at screens, they're not blinking, their eyes are getting dry, they're getting red. It's because they're forgetting to blink. You can supplement with lubricating eye drops. The other tip I have is that when there's a lot of sun, wear sunglasses, but wear sunglasses that have got the CE mark. And what sunglasses do is it protects your eyes from ultraviolet light. All right. As I said, it's important that the sunglasses carry the CE or British Standard mark. There are lots of sunglasses that are out there that do not carry that CE British Standard mark, and that means that they are not filtering out the ultraviolet light that can actually protect your eyes. And they may be quite fashionable and they may look good, but they're not protecting your eyes. I wanted to just go back to the previous slide, actually, just to make a point that it's very important not to look directly at the sun. Because if you look at the sun, you can actually burn a hole in your macula in the center. There's something called a solar burn. I don't know, in a place in India, I can't remember where, they used to have people called sun gazers who would look directly at the sun, and all they were doing was burning their macula, burning the central part of their vision, and they were losing their central vision. And if you can imagine how difficult it would be to go around with loss of your central vision and just relying on your peripheral vision, because you can't read a book on the side of your vision with your peripheral vision. So it's very important not to stare at the sun, and also not to look at laser pointers as well, because laser pointers can burn a hole in your macula too. Stop smoking. Not only is smoking bad for you health-wise, it's not good for your eyes. There are lots of conditions which are made worse by smoking. Macular degeneration, and also people living with diabetes. If you're a smoker, there is evidence to suggest that the diabetic changes at the back of your eyes can be made worse by smoking. So really stop smoking. Okay, what am I going to talk about here? Oh, I'm talking about, oh, right, this is about the vision for driving. Which should have been with that other slide, actually, where I was talking about the limit for driving. That 612 vision chart line for driving for the DVLA. And you've also got to be able to have good peripheral vision. You've got to be able to read a number plate at 20 meters to be able to drive a car. Sometimes people can't get to go to the optometrist, but there are some optometrists that will offer domiciliary care. So if you've got a loved one who is elderly and they can't get to the optometrist, then the domiciliary optometrist can come and visit them at home. All right. It's really important that, for people who are housebound or their mobility is not very good, that they should be able to enjoy their lives. They should be able to enjoy their lives at home, reading or watching television, doing whatever it is that they need to make their lives enjoyable. So you can also arrange for a domiciliary eye test for any of your loved ones who are housebound or have got a physical disability. Children and eye tests, all right? If you've got a baby or a child, and you're concerned about their eyes, the sorts of things that you need to really look out for is if one of their eyes seems to drift outwards or inwards. This is called a squint. It's very important if you see that, if you're a parent and you're parenting a baby or a child, and you notice that one of their eyes is drifting out or in, then that eye is having what's known as a squint. And there are lots of reasons why the eye would drift outwards or inwards. It may be because they've got what we call a refractive error. That eye may be short-sighted or long-sighted, so they may need to have some glasses to be able to see properly. When the brain does not see an image with clear clarity, that's what causes it to kind of drift out. Or it could be that they've got something blocking the vision. It could be a cataract, a congenital cataract. There could be a number of reasons, but it's really important to get it checked out. If you've got a child who has difficulty concentrating or who may have some slight behavioral problems because they may find it difficult to articulate the difficulty that they're having with seeing, or they may even go up to the television very close, or they hold objects up to their eyes very close. You need to pay attention to that and get your child's eyes checked out. Or they may, in fact, have a headache, complain of a headache. These are sort of like little red flags to warn you that there may be something, wrong with your child's eyes, and that needs to be checked up. And again, as I said before, sitting too close to the television or even rubbing their eyes a lot, that might be a reason to get things checked. Now, in my world of ophthalmology, all right, as small as the eye is, ophthalmology is a subspecialist subject. There are different ophthalmologists specializing in different parts of the eyes. There are some that specialize in conditions of the eyelid and the bits around the eye, the tear drainage system called the lacrimal system. There are specialists that deal with just the cornea and the conjunctiva. There are specialists who deal with inflammation in the eye involving the iris and a layer beneath the retina called the choroid. There are specialists who deal with pressure problems in the eye, problems with squint, with the muscles on outside the eye, and the retina, medical conditions of the retina or surgical conditions of the retina. So it's a huge topic, ophthalmology. And in fact, when you go to any hospital, the busiest department in any hospital will be the eye clinic, because ophthalmology, we see about 8 million people each year in total in the country with their eye conditions. And the commonest operation we do in ophthalmology is removal of your cloudy lens, which is called a cataract. And my speciality is conditions that affect the retina. So I'm a medical retina specialist, but I also do cataract surgery as well. The commonest operation that most people will do as ophthalmologists is cataract surgery, plus do another speciality with it. So that's what I do. So now we're going to start with some eye conditions, and we're going to go from the front backwards. So the most front part is your eyelid, and we're going to talk about lumps and bumps in the eyelid. Now, within your eyelid, you can develop lots of lumps, bumps, and conditions. In your eyelids, you've got glands, oil glands called meibomian glands, and those glands can open up at the rim of your lid where your lashes are. And if the opening for the gland at the rim of your lid gets blocked off, it can cause something called a chalazion. So the oil builds up within the tissue of your eyelid, causing quite a painful lump, all right? And there is another condition called blepharitis, where your oil glands secrete too much oil, or you almost have like a dandruff appearance on your lashes. This condition is called blepharitis. A hurdlum is like a sty where there is an infection in one of the little follicles, the glands within your lids. So these things are usually treated with hot bathing, with antibiotic drops and ointment, or in some cases, if a residual lump is left that is not painful, you can sometimes have a minor surgical procedure to drain out that lump. Your lid can turn inwards or outwards. So if your lid is turned inwards, that means that your lashes are rubbing on the surface of your eye. If it's turned outwards, then that means that your tears are not draining into the lacrimal system properly and your eyes can become watery. And there is an operation that you can have to tighten up your lid or make it go back into its normal anatomical position if it's turning inwards or outwards. Trichiasis is lashes literally rubbing on the surface of the eye. And this happens usually sometimes, or actually trichiasis is where the lashes are actually growing in the wrong direction. Your lashes grow outwards, but the lashes are turning inwards, not because the lid is necessarily rolled in, but it's the direction. It's almost like a misalignment of the lashes in your eyelids. And it happens a lot in people who actually come from the Indian subcontinent with the sun and everything. They get a lot of trichiasis. You can have a cancer in the lid. The commonest one is called a basal cell carcinoma, and it can look like a lump on your eyelid. It is much more common in people who are white, I have to say, and it's to do with the sun and its degenerative effects of the skin within the lid. But a basal cell carcinoma will have like a dimple in the middle. Blepharitis is inflammation on the lashes, all right, along the rims of your lids, where you get this dandruff appearance and you get over secretion of the oil. And the problem with having blepharitis, because your tear film is a very complex structure, it can actually make your eyes very itchy, very watery, very inflamed. The rims of your lids can get very red and inflamed. And the best way to deal with that is to do some hot bathing, do some lid margin cleaning. You might need a course of antibiotics. And in some cases, if the blepharitis is very bad, sometimes people have to take antibiotic tablets through their mouth to be able to deal with this. It's almost like having dandruff in your lashes, okay? And it's a chronic problem. So it's a problem that needs to be managed with regular lid hygiene. When the white of your eye, which is called the conjunctiva, becomes red and inflamed, it is called conjunctivitis. But there are lots of different types of conjunctivitis. There is the bacterial conjunctivitis, where you've got the redness, but it's also associated with a yellow, sticky discharge. The children and elderly are more at risk. You can actually treat it yourself by just bathing and cleaning your lids, or you can get some antibiotic drops or ointment from the chemist. You can get it across the counter. But I would say is that if your conjunctivitis has been going on for longer than a week, then it would be best if you went to see your doctor, your GP, to get a referral into the hospital eye service to see if there's something else that's actually going on. So if you've got sticky red eyes for longer than a week, just go and see the GP and get a referral into the hospital eye service. Viral conjunctivitis, rather than the bacterial conjunctivitis where it's very sticky, viral conjunctivitis, your eye is very watery. Viral conjunctivitis is very contagious, very contagious. There will be a history of a recent head cold or a sore throat, something like that. Sometimes the glands around your ear will be a little bit enlarged and inflamed as well. It's a condition that does not get better with antibiotics because it's not a bacterial infection. Unfortunately, it's one of those things that has to get better on its own. you can alleviate the symptoms with cold compresses and with using artificial teardrops. But you've got to be very, very careful. Most people use separate towels within households, but you've got to be really, really careful, not share towels, etc., because it is highly contagious. Now, when the conjunctiva looks like this kind of like jelly type of appearance, this is allergic conjunctivitis. So with any allergy, things swell up, all right? So your eye will be watery, it'll be red, but it looks like there's like jelly on the surface of your eye. Your conjunctiva, which is overlying your sclera, swells up a bit like a balloon, all right? And causes this, and your eye will feel incredibly itchy. There might be a little bit of swelling within your lids. This is called edema. And sometimes people can get an allergic conjunctivitis that comes and goes. And allergic conjunctivitis can be really quite problematic during the summer periods when there's a lot of pollen. And you can get antihistamine drops across the counter. The best drops to deal with allergic conjunctivitis is drops that are both antihistamine. You've got these cells called mast cells that release the histamine that cause the itching and the swelling. So those drops, which are antihistamine, they're called mast cell stabilizers. But you need a combination. You need a mast cell stabilizer and a drop that has got an antihistamine component within it. So it's a combined type of drop. And drops like olopatadine are those combined ones, which are just twice a day, but you can only get them on prescription from the GP. And I think that they work much better than a sodium chromoglycate, a mast cell stabilizer. So these are the features in allergic conjunctivitis. Does anybody know what this is called? Anyway, don't worry, because you'll have to mute people. Nobody will be able to say what it is. It looks very dramatic. It looks so dramatic, and yet it is not sight-threatening. This is a subconjunctival hemorrhage, and it's literally bursting of the blood vessels on the surface of the eye, the conjunctiva, and it looks like it looks like the eye's painful. It looks like, oh my gosh, what's happened? But it's actually not a dangerous condition. It is just something that happens. It can commonly happen in anybody who's on blood thinners like aspirin, warfarin, clopidogrel. People who are on those blood thinners, they can get bruising on their skin anyway, and it's the same thing that can happen on the surface of the eye. It could happen after an eye operation. Blood vessels might be burst, and people think that the eye is infected and it's inflamed. It's not. It's something that resolves on its own. It goes through the same color changes that you go through, for a bruise. And it's really not a problematic thing. Now, I might feel slightly uncomfortable, and you might want to put some lubricating drops in it, but it's really nothing to worry about. As I said, it's common, doesn't affect the sight. Resolution can take 10 to 14 days. It can, the evidence about people having high blood pressure, when patients come with this, we will check the blood pressure, but I'm yet to really find anybody that's had high blood pressure and a subconch hemorrhage, I must say, in my 34 years of doing ophthalmology, but I think it's worth still getting the blood pressure checked. Okay, now I want to talk to you about the tear film and the cornea. The tear film is a very, very complex structure. It's got 3 layers. And if there's any disturbance of any of those layers of your cornea, all right, it will destabilize your tear film. I want to just talk about contact lenses and the cornea. If you're a contact lens wearer, it's very important for you to understand that you've got to do good contact lens care. So what do I mean by that? So let's think about it. Your cornea, there's a bit of a rectangle that's been taken out, is made out of lots and lots of different layers, okay? But your cornea is like a window. You would not want blood vessels growing into your cornea, because if you think about it, if you've got blood vessels growing in your cornea, then your vision will be blurred and you would not be able to see. Your cornea has got the highest number of nerve endings on it, all right? Because anything that goes into the eye on your cornea, automatically, Mother Nature will produce lots of tears to wash that thing out, because it doesn't want your cornea to get scratched, because you don't want your cornea looking like your bathroom window, which is all frosty. You want your cornea looking like your living room window, which is nice and clear. So it's important to keep your cornea healthy. And it's healthy because of your tear film, the tears that moisten the surface of your cornea. The oxygen in the air atmosphere dissolves in the tear film and nourishes your cornea. So when you put contact lenses, bit of plastic on the surface of the eye, you're reducing the amount of tears in your cornea, which is why it's very important that you don't overwear contact lenses. I would advise wearing daily disposable. You should never sleep in your contact lenses, because when you sleep, you don't produce tears. So if you don't produce tears, your eye is going to get dry. And the thing is that you've got to be very careful that you do not reuse daily disposable contact lenses, because you're more likely to introduce an infection into the eye and get a corneal ulcer, and you don't want that happening. So I just want to so yes, people should wear contact lenses, but do good contact lens care. Use daily disposable. Don't fall asleep in them. If your eyes do feel dry, use a lubricating drop that's got no preservative. Don't use anything with preservative, and limit the time that the contact lens is in contact with your cornea. But the commonest condition in the cornea is dry eyes, where your eyes are gritty, sore, uncomfortable. It feels like there's sand in the eyes. And the best way to lubricate or supplement your tears is with lubricating drops, all right? You can get ones with or without preservative. I prefer lubricating drops without preservative. And my lubricating drop of preference is one that's got a sodium hyaluronate in 0.2%. This is somebody who has got a normal healthy cornea at the top, and this is a corneal infection ulcer that developed in somebody who overwore their contact lenses. And if you can see, there's this layer of whiteness at the bottom. It's pus that's gone inside the eye. So you can see the difference between the clarity of the cornea when it's clear and one when there is an infection on the cornea from the contact lens. And contact lenses, if you're using monthly ones, you've got to be very careful about cleaning them properly, not using tap water, none of that stuff, because that's just asking for problems, okay? So there are soft and hard contact lenses. You've got to really wash your hands thoroughly if you're cleaning ones which you are reinserting. And anybody who's got a corneal ulcer, which we've got microbial keratitis, we treat it as an emergency, okay? And the treatment is quite brutal. You'll be on hourly antibiotics day and night for 24 to 48 hours. It's a serious condition because it can result in permanent sight loss. It's really very, very important. Okay, now there is inflammation that can develop inside the eye on the colored part of the eye called the iris. This is iritis. And when the iris gets inflamed, it gets sticky and it sticks down and your pupil doesn't dilate properly. And this is treated with steroid drops. Your lens, when it becomes cloudy, is what's known as a cataract. All right. The commonest cause of cataract is age. And cataract surgery, as I said, is the most commonest operation that is done on the NHS, about 500,000 a year. And my unit, Central Middlesex Hospital in Northwest London, we were the first unit to restart cataract surgery after the first pandemic wave. Bet you didn't know that the instrument that we use to remove cataract, the laser phaco probe, was invented by a Black woman. I'm just giving you a little bit of Black history here. Dr. Patricia Bath was an ophthalmologist in America, and she invented the laser phaco probe to help us do the operation, commonest operation on the NHS. Cataract surgery can be done under local anesthetic. That's me, using both hands, both feet, and both eyes. Okay. And it's a fantastic operation to do because you can just do it with just anesthetic drops in the eye, where we would basically remove the cataract, mash it all up with an ultrasound probe, put a new lens in. It's a fantastic operation. So we're getting further to the back of the eye and we're getting to the jelly of the eye, the vitreous. The vitreous, people commonly get floaters in their eye, which are literally lumpy bits within the vitreous of the jelly. And sometimes that vitreous can pull away and cause a big ring floater called a vice ring. Floaters are common, all right? When the jelly is pulling away, you can get flashes and you can get the floaters. You need to get this checked out if you've got flashes and floaters, because sometimes it might not be the jelly pulling away, it might be a tear or a detachment of the retina that needs to be checked out. So any flashes, like a flash of light, any floaters, go to your nearest optometrist or eye department, get it checked out, because it could be the vitreous coming away, which does not need an operation. All right, this is the vitreous detachment there. Or it could be a tear or detachment on the retina. Through the tear in the retina, it's a bit like wallpaper peeling off the wall, and that will require a surgical operation. All right. So, last few things: macular degeneration at the center of the vision, okay, which can be wet or dry. If it's wet, it can be treated. And diabetes can also affect the eyes. So if you're diabetic, you must attend screening. Screening of photographs. So this is a normal photograph of the retina for somebody who has diabetic screening. I don't know why my screen's not moving along. But I'm actually going to just stop there for the minute because I don't know why my slides were not going along. All right. Thank you for your attention. Are there any questions?
Hello. So we do have a number of questions on our Zoom chat. Thank you once again for that great talk. So I'll head over to the Zoom meeting chat. So the first question is, are you saying that prescriptive glasses are the only way forward? What about eye exercises?
In terms of sight,
Yes.
eye exercises are for your muscles outside the eye. That doesn't have any impact on your focusing ability.
Okay. All right. Well, I'm pretty sure that that would answer that question. So it's totally separate things
Yeah.
from that. Okay. And another question from someone says that they keep on pushing their glasses up their nose. Is there frames made to stop this? I guess that can be really uncomfortable and frustrating.
They just need to go back to the optician where they got those glasses from. They're probably those frames don't fit their eyes properly, their nose. Everyone's nose is different, so they just need to just go back and get that fixed. Or maybe they may need some new frames. Sometimes people have frames that are misaligned. Sometimes people buy frames online or just across the counter. When you're having glasses, you've got to make sure that they actually do sit on your face properly. Sometimes there are these little bits on the side of the nose that need to be repositioned that will actually let them sit on their face properly. So it might be that it's become misaligned, so they just need to go back to their optometrist.
Okay, all right. So back to the optometrist for that to sort out the frames. And we've got another question here. They have it's a person saying, I have glaucoma. I'm taking drops from the eye hospital. Is there any other advice you can give to avoid deterioration?
Yeah, so I didn't get to talk to you about glaucoma, which is one of the conditions, and I don't know why my slides weren't advancing. But glaucoma is a condition where the pressure is high in the eye and it can damage the nerve at the back of the eye. I have to tell you that if you are black, you're 4 times more likely to develop glaucoma, and it's more likely, and it's going to be more advanced than people who are South Asian and people who are white. If there is a positive family history of glaucoma, it is super important to get the pressures checked in your eye. Any pressure up to 21 is normal. But I am telling you that if you are black, it is people say that glaucoma develops in people who are age 40, 50, like older than that. It can be younger than that, and especially if there is a positive family history. There are 2 types of glaucoma. There is narrow angle and open angle. Narrow open angle is where it's a painful, sudden rise in pressure. Open angle, it is painless. And what is happening, remember your optic nerve that I told you about that sends signals from your eye to your brain. You have a field of vision. What happens in glaucoma is that you lose your peripheral field of vision, and it gets smaller and smaller and smaller till you end up with tunnel vision. So that means that you've got no spatial awareness. You're more likely to bump into things. All right. So it's super important, if you've got a family history of glaucoma, get your pressures checked. If you are on drops for glaucoma, take those drops. All right.
Okay.
In our community, I know there's a lot of faith, there's a lot of prayer. I say this all the time. All right. People think that they can pray things away. Do your prayers, go to church, do whatever it is you need to do, but take your drops, take your medication. Okay? Because glaucoma is managed with drops in the first instance. Sometimes it can be managed with laser, and sometimes one will have to then go on to have surgery. All right. It's a challenging condition to manage, but it is best managed by people keeping their appointments, not forgetting to put their drops in their eyes. When you forget to put the drops in your eyes, that's unnecessary damage that's happening to people's eyes.
Okay. All right. And we've got just leading about the glaucoma. You mentioned it's heavily to do with genetics. Is there any lifestyle factors that play into it developing
No.
glaucoma? Okay.
No.
No
You just
lifestyle.
got to positive family history. Okay. And if there's no positive family history, remember about having your eyes checked every 2 years, because if you do that every 2 years eye check, if you do develop it, at least it'll be picked up and it can be addressed.
Okay. So we've got another question. Can you live with floaters?
Yeah. Floaters from degeneration of the jelly might be, there are lots of different causes of floaters, I have to say. All right. But the commonest cause is just degeneration of the jelly in the eye. And yes, you can live with them. It's not, I had a floater. I was driving down the A406 and I got a posterior vitreous detachment. I have to tell you, I'm an ophthalmologist. I've been doing this for so many years. But that was I got flashes and I got floaters and my jelly, came away. I don't notice it now. So what happens is that your brain gets used to that particular floater, and it depends how close it is to the back of the eye, but your brain then switches off that floater and you don't notice it. So yes, you can. If you've got floaters for a different reason, say for example, you've got floaters if you're living with diabetes and you've got diabetes at the back of your eyes, right? Okay, we didn't get that far. Don't know what happened, but anyway, and you've got abnormal vessels growing at the back of the eye from diabetes. The floaters could be from bleeding from those abnormal vessels. There's another condition that can cause abnormal vessels to grow at the back of the eyes, and that is sickle retinopathy. Sickle can actually cause abnormal vessels growing at the edge of the retina. And again, if you're living with sickle cell and you get floaters, you need to get it checked out to make sure you've not got abnormal blood vessels growing at the back of your eyes.
Okay. So in some cases, you just end up living with it and getting used to it, but in
Yes,
other
and
cases, it can be
and
quite serious.
it's just part of your eyes. In other cases, if you get thousands of floaters, like you feel like you're in a snowstorm, the snow's black, all these black dots, lots of them, that is a red flag. Go to an optometrist, go to an eye department, because it could be a tear or detachment of the retina.
Okay. Could be okay. So there's
I don't mind staying on a bit longer if everybody, because I can see there's loads of questions coming
yeah.
in. I do have
So
an engagement party to go to, but I will sacrifice the start of that engagement party to answer these questions. I don't
yeah.
mind.
All right. Thank you. We'll run through the next few that we've got here. We've got, is retinitis pigmentosa
Pigmentosa, hereditary, yes, it is. Yeah.
All right, that's a straightforward question that it is hereditary. Okay, for those who use daily contact lenses, should they use
Yeah.
a new one if they have a nap in the day?
That's a very good question.
Mm.
That's a very, very good question, actually, if they have a nap in the day. I would say, think about it. You've got your cornea, which I told everybody about, all right, which is supposed to be clear. You've got a bit of plastic. I know I'm sounding really rude, but it is literally a bit of plastic, stopping oxygen, stopping moisture. Then you've closed your lids on top of it. That's going to make your eyes really dry.
Mm.
I would actually take the contact lens out if I'd slept. If I'd
Okay.
slept off and just give your eyes a bit of a rest. I think contact lens wearers should always have a spare pair of glasses to give their eyes a bit of rest. I wouldn't put another contact lens in straight away. I might want to just lubricate my eyes. I might want to see how my eyes feel. Because you've got to remember as well that people who are contact lens wearers, I wear glasses. I'm slightly short-sighted. My eyes are so sensitive. I cannot put contact lenses. I was working in the contact lens clinic in Moorfields, and I thought, let me just try what it feels like to put a contact lens in my eye. I thought, oh my God, I could not stand it. I had to put anesthetic drops to put it in. That is
Mm.
how sensitive my eyes are. So people who tolerate contact lenses, their threshold for feeling something in their eye is slightly higher than everybody else. Do you understand? So they may not realize that their eye is actually very dry. Most people who don't wear contact lenses would notice dryness. They will not.
Okay.
So I would recommend actually just taking the contact lenses out, lubricating, using your glasses, not putting anything in. If you needed to go out for something in the evening, then yes, maybe then put the contact lens in. That's what I would suggest. I don't know whether there's any hard and fast rules about it, to be perfectly honest.
Okay, that was a very clear answer though. Thank you. So we've got another question from YouTube. What is the best solution for those lumps that come up due to mild blockage in tear ducts?
The best solution is to prevent them and to do if you've got blepharitis, if someone's told you that you've got blepharitis, I think this is the most boring thing to do on the planet, is to do hot bathing of your lids day and night. But I would do it. All
Okay.
right. Okay. Now, if you go onto the RNIB website, right, they have got lots of little PDF books about all these conditions, and in the part where it talks about dry eyes, it will explain how to do something called lid hygiene. So I would get everybody to follow the process for lid hygiene. I don't know whether anyone can put the link in the chat for the RNIB. That was actually on my last slide. Let me see if I can do it. And it will, and they've got loads of, it's such helpful resource. I'm copying it now. I don't know
Okay.
whether anybody going to put it in the chat for everybody. Paste. That's it. It sounds really dramatic, the Royal National Institute for the Blind, but they've got so many helpful resources about all the conditions I've talked about: dry eyes, glaucoma, diabetes, diabetic retinopathy, sickle cell, everything on the RNIB.
Okay, thank you
Um,
for that resource. And we've got another question here that says, I have glaucoma and I'm on eye drops, Lantoprost. A pharmacist,
Frost, yeah.
a pharmacist abroad recommended that I should also take lutein and zeaxanthin capsules.
Right. Okay. So
Yeah.
that pharmacist is just trying to, I bet you needed to get those lutein and zeaxanthin capsules from. It's going to help the glaucoma. Lutein and zeaxanthin are natural pigments within the macula, which is what I was talking about before when I was talking about the macula. All right. You can get lutein and zeaxanthin from diet, kale, highly colored veg, things like that, right? If you wanted to supplement with capsules, you could, but I always think it's nice. You can just take it naturally. Go onto the RNIB website, look at the book that talks about macular degeneration, and it gives you a list of all the the products that are rich in lutein and zeaxanthin. I'm just gonna share my screen very quickly to show you what the RNIB website looks like. It looks like this, right? Can everyone see that? Yeah,
Yeah.
yeah. And if you can just search for anything, on there. Look, all right, look, macular degeneration, go to macular degeneration, and then you can then either download or look at the PDF document. So if you look at the PDF document, and they all look like this, they're all like that, right? All of the booklets are all like this. This is just loading up. And if I did Control F and I typed in lutein search, this is where it talks about lutein. Okay. And you can read all about it and all the different things. So that's what I would recommend. Just have a little look, have a little read. Yeah.
Yeah, brilliant. Thank you for that. We've got another question that just came through. Does wearing mascara harm the eyes at all?
Well, I mean, I've got mascara on and I've got eyeliner. I can only wear one particular mascara and eyeliner. It doesn't harm the eyes if you remove it with a good eye making removing cleanser at the end of the day and don't sleep in it. All right. Because I think that very rarely you can get some people who get lots of buildup of makeup in the rims of their eyelids. And then what that will do is it'll block up the meibomian glands, the glands that release the oil for your tear film. So yeah, just obviously wear something that doesn't sting and make your eyes all run and make your makeup look terrible. Yeah. But just take your makeup off and use an eye makeup remover as well.
Okay, thank you. Going on, we've got another question. After having your cloudy lenses replaced, do you still
Yeah.
need to go for regular eye checks? And what are the risks of replacing the lenses?
Okay, so if you do a cataract operation, all right, first of all, can I just tell everybody, I need to do another session on the whole thing about cataract surgery, because there are so many of these private providers that have set up and they're just doing cataract surgery left, right, and center. And people do not need to have a cataract operation unless their vision is blurred. All right. Just because you've got cataract, you do not need to have a cataract operation. Everybody thinks this is me getting my bee in my bonnet. I need to just like calm myself down and not get too upset about this. But when you've got cataracts, you only need to do an operation if your vision is blurred, right? If you're a driver and you're not at the legal requirement for driving, then, and it's because of cataract, then you should have a cataract. If you've got cataract and another condition like diabetes or glaucoma, you must. People, listen to me here, because diabetes and glaucoma is common in our community. You must go with a surgeon who is going to be able to manage both your cataract and the diabetes in your eyes. all the cataract and the glaucoma. Yeah, because there are some people who are having cataract surgery by private providers. I'm going to say this, and the private providers are just dealing with the cataract and they're not managing the other condition, and the other condition is getting worse and it's affecting their sight. All right. So first of all, understand, and also on the RNIB website, there is a booklet about cataract. So read about cataract first to make sure that that is actually what you've got and you understand it. But when you remove your lens, you need to see. So you've got to have a lens implant put in place. So on the NHS, you will have something called a monofocal lens. That lens will give you good focusing with no glasses, usually for distance. You will need glasses for reading. Some people opt after cataract surgery, especially short-sighted people who are used to wearing glasses for distance, prefer to just not have glasses for reading. So they want reading vision, and then they put their glasses on to see in the distance. Because on the NHS, multifocal lenses are not available. Multifocal lenses will allow you to focus for distance, middle, and near. Multifocal lenses are only available privately. Okay? So you will need glasses for reading. The other thing is that even though you've had the cataracts removed, you should still have your eye tests every 2 years, because you could still get high pressure in the eye. You could still have signs of maybe blood pressure at the back of the eye or diabetes. So I would say yes, still have your eye tests every 2 years, just to make sure you don't get any of those conditions.
Okay, brilliant. Okay, thank you for that. We also got a comment where they said they were really keen on having a cataract talk as well. So we've got some interest in that. Another question, I keep on getting chalazions and having them removed. How can I prevent these, and do false eyelashes contribute to this?
Yes, 100%.
Yes.
If you think about it, you get chalazions because of the meibomian gland. All right. Let me just quickly see if you get a chalazion because of the meibomian gland. And the meibomian gland is what releases oil in the rim of your lid. I'm just going to try and quickly get up the book about just to show the diagram of the eyelid. Sorry, everybody. You shouldn't get me talking about my own topic, because I then talk about it too much.
We're all very interested. You've got loads of questions coming through. So
okay, so I'm just going to share with you the dry eye booklet from the RNIB. All right. So do you see this structure here? This is the lid, right? That's the eyelash. Behind the eyelash, that yellow thing is called the meibomian gland, and it releases oil, the oily part of your tear film. What happens is that when you have false eyelashes put on, the glue that's stuck where your lashes are sometimes blocks the opening for the meibomian gland. All right. And because the gland is still releasing the oil, it builds up within the lid. That's a meibomian gland or a chalazion. So 100% it's from the glue from the false lashes.
okay, all right. So we should try and stay away from false eyelashes as much
Well,
as
I'm
we
not saying
can.
people should stay away from false lashes.
Okay,
All
not
right.
saying that.
But I'm saying, what I'm saying is that that person may already have blepharitis.
Okay.
So that needs to be treated first.
Mm-hmm.
Okay. Or maybe they don't have the ones that are necessarily permanent, and maybe they have the ones which you can remove, like the strep.
Okay.
Yeah. So then they make sure that they clean off their lids properly.
Mm-hmm.
But if you keep on getting them, you need to see an ophthalmologist that specializes in the lids
Okay.
and find the reason, because they may have an underlying blepharitis condition that's predisposing them to getting chalazion, and the false eyelashes with the glue may not be suitable for them. And if they do want to do it, they may have to do the ones where they take it off.
Okay. Well, we've got another question which says, would you recommend laser eye surgery to improve vision?
So basically, laser eye surgery, which is not available on the NHS, people are talking about LASIK. And that's basically laser to change the shape of your cornea so you don't need to wear glasses or contact lenses to see. That's not a procedure that I do, and it depends what job it is that you do. But if you are going to do laser corrective eye surgery, make sure you a um, see somebody who is suitably qualified to do that procedure, because that's a permanent procedure that's being done on your eyes. All right. I think that for correcting short-sighted or long sight, the first thing is either live in a world of blur with no glasses, if that's what you want to do, if you don't drive, or have glasses. Then, if you don't like glasses, then contact lenses. Then, if you don't want to do contact lenses, then it's something that you can consider. But you just need to have a good opinion about the benefits and the risks. I'm not recommending it, and I'm not recommending it. It depends on the individual person, depends on their job, depends on what they do. All right. But I think if you're fine with glasses, use glasses. If you're fine with contact lenses, use that. If you want to do laser corrective surgery, then you need to make sure that you're gonna have that treatment, by somebody who's suitably qualified.
Okay. Thank you so much. And thank you for all the questions that have come through and your answers. It's been great, Miss Mensah. We're going to hand over to Sam from Khan. I know we've still got some questions going through, but maybe they could be answered on another time.
Maybe I'll just do this another time when
Yeah.
we talk about cataract. All right.
Yeah.
Thank you so much,
Thank
everybody.
you. I'll hand back
Thank you.
over to Sam.
Thank you very much, Miss Evie and Dr. Kemi. I think it's quite evident that we need another session on this. It was quite informative. As someone that wears glasses almost every day and contacts almost every day, this has been very, very informative for me. Yeah, sometimes I just leave my contacts, so now I feel like I was getting told off. But yeah, no, I'm gonna reduce doing that. It's crazy. Reduce doing that and just take care of my eyes a bit more, because yeah, I think for me, my biggest fear is like losing the ability to see as clear as I do with my contacts. So yeah, I think I'll take my eyes a bit more seriously. And thank you very much for all the information that you provided, Miss Evie. If you have any more questions, those that are listening on LinkedIn, Zoom, wherever you're listening to this on, whether you're listening to this days later or weeks later, please email health@khan.org.uk, and we'll be able to get to your questions, or we'll be able to pass them to Miss Evie, and hopefully she can answer them when she's available. I'm just going to quickly go through some slides before we round up the session about some upcoming things within Khan and the community, and please feel free to take notes of these. Go on our social media, click the links, and get involved with the things that we're doing. So the first thing I'd like to tell you guys about would be next week we'll be having a session on dementia, when memories fade, and hopefully everyone that's tuning into this and everyone that's tuning into previous sessions, feel free to come along. It's going to be the same link. We have Dr. Ammonia that's going to be speaking to us, and please come with your questions and learn more about dementia, because that's something that does affect our community, as we are sometimes late to speak up about certain things going on within our families or going on within our community. So there's opportunity to come and get some much needed advice and support. We have the Black History Month Media Comms event coming up soon on the 16th of September. If you know anyone working within the creator space, whether you post on social media, on your own personal content, and you're trying to, go viral, as they say, or get a bit more engagement, or anyone working within comms, marketing, PR, we are trying to add and amplify the voices in Greater Manchester and beyond for Black History Month. So we are hosting an event. It's going to be a virtual event. Feel free to register via the QR code or email in social media at khan.org.uk for more information. All are welcome, and we are trying to hear just to amplify the voices of the Black community, so we tell the stories that we want to tell in the way that should be told by ourselves, by the way we find it authentic, opposed to someone else doing it for us. So feel free to come along to this event. As previously mentioned in the talk by Dr. Evie, Black History Month, there's a lot of things going on within Black History Month. There was as she said, the first lady, the first ever cataract surgery was created by a lady, Black lady. In fact, I didn't know that. So that's something that you learn about just listening to these talks. And this presentation I'm giving quickly is going to be heavily on Black History Month. We have a Black History Month event coming up in Manchester. It's going to be at the Gorton Monastery in Gorton. So please feel free to come along. If you have any business or anything you want to showcase to the people, to the community, please scan this QR code, reserve your spot, and showcase your work, because we'd love to support what our community is doing to the wider audience. That being said, do come along to the event. It's on the 25th of September from about 7 p.m. Doors will open a bit earlier, about 6:30, so feel free to come down after work and let's kickstart Black History Month in Greater Manchester. There's an event we always hold. Normally we'll hold it at the Manchester Cathedral, but this year we tried something a bit different, somewhere a bit more accessible. And Gorton is the place to be, and this place that I'm gonna expect to see you there. So when you do come down on the 25th of September from about 6 p.m., do say hi to me because I'll be there. And registrations is free, and it's free to attend for anyone that is interested. This and the other event I previously mentioned. Nominations for our Black History Month Gala event is almost up. Nominations closed on the 26th of August. We've had a considerable amount of people giving nominations, but we want to make sure the opportunity is available for everyone else that didn't know about this or want to provide more nominations for those friends or families that they feel like are doing wonderful things within the community. This is your opportunity to celebrate those in the community that you think are champions. We have various categories. I think we have about 10 categories, from the Young Change Maker of the Year to Young People's Organization of the Year to anti-racist initiatives, which I know Miss Evie always champions. She's quite a big advocate of people being inclusive and being respectful of everyone around her and around themselves. So if you have any nominations, please do put your nominations forward. If you have any questions, please contact bhm@carn.org.uk. And lastly, I'd love to invite you all to our Black History Month Gala. This is happening on the 11th of October from 6:30 at the Runway Visitors Park. This is going to be a great event. It's going to be a 3-course meal black tie event. You come dressed up to network. I see wonderful people in our community who are doing great things being awarded, as well as seeing the wonderful councillors and mayors within our Greater Manchester Borough engaging with us, because that's important to them and it's important to us that we see people like us in these places. And we have a special offer for the early bird ticket holders and ticket purchasers this year. If you do purchase the early bird ticket, you do get a chance to get either 10 raffle entries to special prizes from spas, treatments, getaways, and all the other stuff that I don't want to reveal too much. Or you get a £10 drinks voucher for the bar for those that drink alcohol or don't drink alcohol. The choice is really yours. So get those tickets, guys, and take the chance to get these raffle tickets, because I know a lot of people won stuff last year. I might try to get some more raffles for myself this year. I didn't win anything, the luck of the draw. But I'm hoping this year I get something, and I'm hoping that those of you that purchase tickets will also be in the running to get some prizes from the raffles. And if you do have any other questions, as I said before, please contact health@carn.org.uk if it's about this session, about previous session, or any interesting topics you'd like to learn about. And again, I want to say a big, massive thank you to every single one of you that tuned into this live and everyone that's tuned into this post event. Thank you very much, Miss Evelyn Mensah, for this very informative session again. And thank you very much, Dr. Kemi, for hosting it. And I hope everyone has a wonderful rest of their Saturday, and I'll see you later. Bye-bye.
Welcome to our Caribbean and African Targeted Health Improvement Programme, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our Health Hour sessions, spread the word in our community,